Ramadan Kareem. Ramadan is not only a month of fasting, it's also a month where we strengthen our faith by prayers. A lot of couples do consider having fertility treatment in the month of Ramadan, and we are here to help you navigate you through this journey. IVF during Ramadan amongst Muslim patients is not very common, but the trend is changing. A lot of couples are now opting to have fertility treatment done during the month of Ramadan. And we are here today to help you do the right things and also help you guide how you can navigate this journey. Muslim patients frequently have the concerns about how they will have treatment during the month of Ramadan, and these concerns mainly come from taking injections, coming to the clinic for their scans and appointments, and also the egg retrieval procedure. Muslim men also have concerns regarding giving a sperm sample in the month of Ramadan. During fasting, IVF medications don't have a significant impact or alter the effect of the medications. You can still carry on taking your injections or as normal. However, you do need to change the timings of your injections. For example, the antagonist injection can be taken during the time of suhoor, and the stimulation injections can be taken after iftar. So that does not alter the impact of fasting on your uh, treatment or on the egg quality. Fasting during certain times of your IVF journey can be a challenge. I would advise women not to fast on the day of the egg retrieval and possibly the day after. And the same goes for the men as well. They will not be able to fast on the day of giving us a sperm sample.
So hydration during Ramadan while performing an IVF or going through an IVF is very important. Hydration is super important for a blood flow. We want a proper blood flow for the uterus, for the embryo, for the proper implantation. Hydration is very important for detoxification of the body. And after the IVF, we have a lot of hormones and medications that needs to be detoxed. So proper hydration is very, very important. It's also very important to transport the nutrients and the medications. You need a good fluidity in the blood so that the medications and the nutrients are transported properly to the organs.
How many liters of water would you recommend that women drink, during suhoor and after they break their fast?
So, what is more important than how much water we need to drink? It's important to drink it in small sips throughout the non-fasting window rather than drinking it in one go. So, it's very, very important during the fasting to keep the hydration in small sips from the iftar till the suhoor so that we have a proper hydration. What's also more important is adding electrolytes to the fluids. Electrolytes will help lock the hydration inside the body. One way is to drink coconut water. Another way is to have a glass of water with a little bit of Celtic salt. Another way would be adding bone broth. Bone broth is a gem in terms of nutrients and vitamins. It can enhance hydration. It's full of vitamins and minerals, specifically potassium, magnesium, and other vitamins that are very important to be renourishing the fasting state.
Sarah, one more thing I noticed from the women who come to see me, that they tend to drink no water and mainly juices or weak tea or weak coffee. So
That's
what
a
would
big
you?
no-no. That's a big no-no during the fasting, whether you're going through an IVF or not, and that's a big no. The reason is that juices will spike up the blood glucose, and during an IVF treatment, one of our main targets is to stabilize the blood glucose as much as possible. So juices will cause this spike of blood glucose, and this is not great. Also, drinking a lot of coffee. Coffee is a diuretic. Diuretic means that it removes the water outside the body. So also it's opposite to the hydration. So it's very, very important to focus on water as your main fluid during Ramadan.
So Sarah, what would you recommend that our couples who are going through fertility treatment have during suhoor and during iftar to improve their chances?
So during Ramadan, it's very important to look at the fasting hours. Now we're lucky that in February the day is shorter, so the fasting hours are shorter. And why is that important? Because we don't want to have extended hours of fasting that can put so much stress on the body. So it's very important to have suhoor closer to the dawn, just before the dawn, so that we decrease these fasting hours. And on suhoor or on iftar, we need to make sure that we are prioritizing three important ingredients: proteins, fat, and fiber, and then adding a complex carbohydrates. When we are eating enough fibers, we are stabilizing our blood glucose levels, and that's very important for our egg quality and the implantation later on. When we are eating the proteins, it's the building blocks of our hormones, and it's one good thing to keep the satiety stable. So fat, fibers, and proteins. Good fats are very important. We need to focus more on. So we need to focus more on the good quality fats during both meals, whether it was iftar and suhoor, and also to add a complex carbohydrate such as sweet potatoes, whole grain cereals, baked potatoes. Avoid the deep fried foods as much as possible. And this applies to iftar and to suhoor. So during iftar, it's very important to keep proteins, fats, fibers, and a complex carbohydrates. It's also beneficial to start the iftar with a bone broth. That is very important to break the fast with, and then maybe later a date or two, but do not overdo it with dates because it can spike up the glucose too much. And then in your main meal, you need to focus on proteins, fats, fibers. Proteins, I'm talking about meat, chicken, fish. Fibers, I'm talking about vegetables, and a rainbow of vegetables. That's super important. Rainbow of colors, because that can give us different nutrients and different vitamins and different minerals. Good fats, using olive oil, adding nuts and seeds to our dishes, and avoid as much as possible simple sugars like juices and sweets on that meal. The same applies for suhoor. Make sure you are pushing the suhoor closer to the dawn. And on the suhoor, we need to focus also on proteins. Proteins for suhoor can be eggs, can be cottage cheese. Carbs could be oats, could be whole grain breads. Fats, avocados, olive oil, nuts and seeds as well. And keeping the hydration between iftar and suhoor on the go, and adding a high protein snack if possible between the two meals. That would be great.
As Sara mentioned that it is important to have the suhoor closer to dawn, the other important aspect is sleep. It is very important to catch a few hours of sleep after iftar and before suhoor. A lot of couples generally tend to stay awake the entire night and then have suhoor and go to bed and wake up quite late. That alters your circadian rhythm. And when your circadian rhythm is altered, that does have an impact on your hormones as well. So, if you want to have a good outcome of your treatment cycle, then it is better that you get a few good hours of sleep, which will then improve your chances of your success as well as improve the egg quality and embryo quality.
That's detrimental and very, very important. And I always advise my patients is that don't change the cycle of your sleep during Ramadan that much, because that can have an impact on your hormones. What I always advise them is that keep your sleeping time closer to your regular, and try to wake up at suhoor, and maybe you can stay late. You can stay wake up after suhoor and continue your day so that you sleep early. That would be better and great if it's possible.
In Ramadan, women undergoing fertility treatment are very concerned about the supplements that they take. Most women are on quite a few supplements, and women do get anxious about it. Periods of fasting, how do we cope? I'm taking this supplement in the morning after breakfast, I'm taking this supplement after lunch, and I'm taking this supplement after dinner. Now that I'm skipping lunch, how do I manage? Where do I take these? It's absolutely fine if you take them all together at one time or divide them and take some during suhoor and take some after iftar. It won't impact or it won't make a huge difference.
It's also important here to add that there are certain supplements that we can take them, that we should take them with fats like vitamin D and omega-3. So it's better to make sure that we are having good fats in that meal. There are supplements that we can take them between the meals, that they don't need to be with food. So this is also like B vitamins, for example. So it's very important to revise with your doctor or practitioner before Ramadan on the schedule of the supplements, so that they are taken at the right time.
But it is easily achievable, so you don't have to be anxious about cutting down onto your supplements or reducing the number of supplements that you take. The same supplements can be taken during the period of fasting. During Ramadan, I don't think women need to take any additional supplements. If you have a balanced diet, and as Sarah mentioned, good hydration with electrolyte supplementation, then the medication that you're taking should be enough to have good outcomes and good quality eggs and sperms. Egg retrievals or embryo transfer procedures are not done differently during Ramadan. We still have to follow the same protocols as we do routinely. Women should not fast on the day of egg retrieval because they will need to have IV fluids as well as they're undergoing a surgical procedure. The egg retrieval procedure is done under anesthesia. So fasting on that day is not recommended. And also the following day after the egg retrieval, I do not recommend women to fast because they will still feel tired. Plus, there might be some bleeding as well. So, not recommended to fast on the day after the egg retrieval procedure. For embryo transfer, because this procedure is generally not done under anesthesia, it is still possible to fast. Timings for embryo transfer wouldn't be any different, but fasting during embryo transfer procedure is still possible if the women wish to do it. Women may be concerned about having a full bladder before the embryo transfer, but the bladder will be full. There is some amount of urine production happening per hour every time in our body. So, as long as you make sure that you don't pee for a long time, then your bladder is going to be full for an embryo transfer.
When we're talking about equality, we are focused on three main things usually: lowering the inflammation, decreasing the oxidative stress, and balancing the blood sugar. So when we're talking about the oxidation, it's very important from its name. Oxidation is to get antioxidants. Antioxidants, you can find them in your diet, in fruits and vegetables. And when you are taking different colors of fruits and vegetables, you are improving and increasing the amount of these antioxidants. One of the very important antioxidants is the anthocyanins, where we find them in the purple vegetables like berries, purple cabbage, beetroots, etc. One other thing that we need to add to the diet is omega-3. Omega-3 is very important for lowering the inflammation. Omega-3, we find it in fatty fish, in walnuts, and chia seeds, and flaxseed. It's also important to add an ample amount of fibers. Fibers are very important for stabilizing the blood glucose levels, and this is very important as well for the equality. And having proper hydration as well is very important for the egg quality.
Women during IVF treatment, especially in the month of Ramadan as they are fasting, may be concerned about the impact of their fasting on the egg quality. There are no studies as such for women who are fasting in Ramadan and the impact on egg quality. However, the closest analogy is from intermittent fasting. So we can apply those studies for the month of Ramadan as well. And intermittent fasting, especially for women who have polycystic ovarian syndrome, has been shown to improve the egg quality. It reduces your testosterone levels, it reduces inflammation, and thereby improving egg quality. So we will get better quality eggs and thereby better embryos as well in the month of Ramadan. Also, you can consider the month of Ramadan as a detox period. Again, when you detox your body, you're removing all the toxins with the help of fasting. This again will indirectly improve the egg quality.
So one of the common mistakes that we see during the month of Ramadan is that people relying heavily on inflammatory foods. We know that this month there is a lot of sweets, there is a lot of deep fried foods, and my message always is to avoid as much as possible inflammatory oils in your food. Inflammatory oils, we find them in seed oils and hydrogenated oils. So as much as possible, try to avoid these inflammatory foods during this month. Inflammation is the enemy for the egg quality and the procedures of the IVF. One more thing that you need to focus on is, as much as possible, lowering the intakes of simple carbohydrates and sweets, because we also want stabilized blood glucose levels. It's also important during this month to avoid skipping the suhoor. That is a very important meal. And the last thing that I would want to say is ensure proper hydration during the non-fasting hours so that you are covered during the dry fast during the day.
So if you're planning to have your fertility treatment in the month of Ramadan, don't be scared. It is manageable. Injection timings, supplement timings can be adjusted. But most important, stay healthy. Like Sarah mentioned, do not skip suhoor, have iftar on time, sleep well, and inshallah, we will have a blessed month together.